We'll give it one more minute. We'll start at 12:05. So Tiffany, you can start recording.
You are recording.
Good afternoon, everyone. My name is Chris Nicolopoulos, and I'm the Commissioner of Insurance here in New Hampshire. A couple of quick reminders for folks. We ask that you put your teams on mute. If you have a question you want to ask during the presentation, feel free to select the raise your hand icon. You should find that in the upper taskbar on the right-hand side of the screen. Once your hand is raised, Marty Mobley will recognize folks when there's a quick break, and Tyler or the team here will answer. Today, I'm joined by at least 6 of my colleagues. I'm going to quickly go through those and then turn it over to DJ. But I'm joined by DJ Betancourt, the Deputy Commissioner here at the department, Tyler Brannon, our Life and Health Director here, Tiffany Fuller, our Outreach Coordinator, Keith Nyan, the Head of our Consumer Division, Maureen Mustard from our Data Analytics Division, Marty Mobley, all things legislative. Thanks, Marty. And our newest staff member, Lisa Cota-Robles, who's our Director of Health Reform Coordinator. Thank you all for joining. DJ?
Thank you very much, Commissioner. As the Commissioner said, my name is DJ Betancourt, and I have the pleasure of serving as the Deputy Commissioner for the department. Before I put in a plug for our Consumer Division, I did want to thank 2 members of our team who have helped put today's presentation and event together. The first is Marty Mobley, who, as the Commissioner mentioned, is all things legislative. She does a fantastic job for the department in handling our legislative matters. The other is Tiffany Fuller, our Outreach Coordinator. Those of you in the legislature, I look forward to all of you seeing her more often out in the community, doing outreach and promotion of the work that the department does. As the COVID pandemic winds its way down, that's really going to open up a lot of doors of opportunity for Tiffany to get out there. And I know that she's looking forward to that, and we're looking forward to that as well. I also, of course, want to thank Tyler, who has not only been the brainchild of this health cost tool, but is so gracious with his time to do these presentations. So I want to thank him as well. But obviously, having served in the legislature myself, I appreciate how seriously our legislators take their constituent service obligations and their constituent service work. We have a consumer division here at the department that exclusively handles constituent issues, regardless of the type of insurance that you're dealing with. They handle everything from health to property and casualty, annuities, life, you name it. They are versed to handle issues that the public has. It's a great team of individuals. It's led by Keith Nyan, who, as the Commissioner said, is on the call with us today. And they can assist with any issues that you have on behalf of your constituents, or you can direct your constituents directly to the department. Every issue that comes into that division is handled on an individual basis, and where we have the ability to take action, we always do that on the consumer's behalf. So keep that resource in mind as you go forward. So with that, I will turn things over to Tyler to get this presentation started today.
Great, thanks, DJ, and thank you, Commissioner, for the introduction. And it is my pleasure to talk about health cost. I've got about 6 or 7 slides I'm going to go through, but much of the time I'm going to spend actually looking at the website, exploring different areas, and really digressing as much as you'd like if you've got particular questions. I came to the department 15 years ago and started as the department's healthcare statistician. And the first project I worked on was to develop the methodology in the rates for health cost. It was new at the time, but we had access to the claims data, which are used to produce the rates. And we were doing something that nobody else in the country had ever done before. So I'll start with the slides, and I'm going to attempt to share my screen. Hopefully we won't be doing these virtually for much longer, but for now, we'll deal with as well as the technology allows us to. So just to say something a little about the website. So it actually went up on February 28th in 2007, so almost 15 years ago. And we promised it would be up by March 1st, but being an insurance department, we got it done early. We faced a lot of kind of concerns about how we wouldn't be able to do something like this. In fact, we were told nobody could do this. Part of the reason is because every patient is treated differently. There's too much variation. Then it led to, well, the proprietary nature of the data means that you can't post prices. And then finally it was, oh, you've done this. Has anybody slashed your tires yet? What about your knees? Anybody threaten to take out your knees? Well, the good news is we survived all that, and we've always been quite straightforward about what we're doing. We've never used any proprietary tools. We've always been transparent about how the mechanism works, and we're using actual claims data, so data that reflects individual patient experiences, not information that's provided to us by an insurance company or a healthcare provider when they may have a particular agenda in terms of how the information is shown. To take a step back before we get into the website, I'd like to show you the statute that enables us to produce information on health cost. The statute is a part of the insurance code that makes reference to a New Hampshire Comprehensive Health Information System. This is an anonymous database of actual claims data that are the result of our authority to collect the data and produce information that is not just for users of the insurance department. It's actually intended to be a public resource for different groups, as you can see in terms of what's written in the statute. I would say the legislation passed in part because of the leadership of the insurance department at the time and the interest in price transparency. But I would also give credit to Representative Neil Kirk, who wanted that type of price information in the public domain, but also was concerned about any limitation or access to patient information. So as a state, we are actually prohibited from collecting any direct patient identifiers. We can track the healthcare use with a particular person, but we can't go back and identify how any of those people are. I would add there's no statutory or administrative requirement for the insurance department to produce a website like Health Cost. It is simply a project we decided to take on, really to reflect the intent of the statute and the legislation that produced it. So what's unique about health cost and what is it? Cost in healthcare is one of the most abused terms that's out there. Sometimes when you refer to cost, you're referring to the provider's charges. In other cases, you're thinking about the cost to the actual organization. You could break that down further between fixed cost and variable cost. And in other cases, it's the cost sharing you pay when you actually receive a healthcare service. But what we've done is we've posted the actual prices. So the prices reflect a negotiated amount between the insurance company and the healthcare provider. And that's important because your cost sharing is going to be based on that negotiated amount. So for example, if the provider's charge for a service is $1,000 and the negotiated amount is $500 and your deductible is at least $1,000, you're actually going to pay $500 for that service. So when we want to tell you the price of a particular service, the $500 is what we want to tell you. So we've used the claims data to consider that $500 regardless of whether or not the member paid it through the deductible or if the insurer paid the whole thing. That reflects the price of healthcare services. And the consumer has always been our target audience for these services on the website. So we now have more than 200 medical and dental services, and from a range of radiology to office visits to emergency room visits and a number of other types of treatment. That's up from about 40 when we started the website. And we've always focused on the types of services that first are very common, that people might shop around for, and that they actually understand. It doesn't make much sense to put a service or a procedure on the website that nobody can even figure out what it means. I would say that we also include thousands of rates listed for providers and payers. When we first put up the website, in the first day, we had 10,000 hits on it. And the groups that knew what we were doing were your insurance companies and your healthcare providers. Everybody wanted to see where they stood relative to one another. So today we actually produce information intended just for those groups. It's much more detailed. It's not edited in any way. It's not filtered. And it may or may not be useful to those groups, but we assume a certain level of sophistication and not using the information the way a consumer would. And I'll give you examples of that when we get to that point in the website. The other thing we did is we started with costs because, well, that's easiest for an insurance department to do. We've got the claims data, we can look at the price of services, and at some level that was what was intended with the legislation, look at the healthcare cost and utilization. Quality is a lot harder, and the sophistication needed to sort of look at the quality of healthcare, which is often very subjective, is not something we were able to do on our own. We do include quality now, though, on the website. It's often better to look at cost as well as quality at the same time. And indeed, the omission of quality is one of the early criticisms of the website. But those quality metrics do rely on CMS and Medicare data. And what is measured from a quality point of view is a little different than the actual services we post. But again, I'll go through some examples of that. Finally, when we started the website, we were thinking about both consumers, patients who are receiving healthcare services. We were also thinking about employers. They're a major purchaser of healthcare. They want to know more about the price of services and how they can influence their benefit designs to use healthcare services most cost effectively. But going down the road of the employer was something that we could see being very different. While the employer may have interest in kind of consumer pricing, we decided to table that part of the website. But today we include a lot of information just for employers, and we use a number of different resources to pull that information together in what is hopefully a very user-friendly format. So why does it exist? At a very basic level, there was legislative interest in providing patients with healthcare information, or at least cost information, price information. As I mentioned before, the website was created in 2007, so we've got now almost 15 years of experience with it. We are a neutral party. As I mentioned, we don't have an agenda for how the data show up. We don't have any particular interest in one group or one provider, one insurer looking more favorably, unfavorably. We can pull the data together and avoid certain things that might come up like antitrust concerns if providers are trying to do this. There is also the recognized potential for improved market efficiencies. Hopefully, when you put up price information, the market responds, both consumers who may choose a lower cost provider, but also the healthcare providers. They'll take a closer look at their cost structures and figure out whether or not they're competitive in the market for the services they're offering. And indeed, actually, more recently, we've seen some success on that front. So there's been a lot of national interest in adopting the New Hampshire approach. I've probably given 100 presentations on health cost and talked to representatives of different states at least 2 or 3 times that. And the only state we actually sat down and went through the programming code to produce information the same as what's on health cost was the state of Maine. We certainly didn't want to be supporting an algorithm or a code that would take a lot of New Hampshire resources. But Maine was the only state that started collecting claims data before New Hampshire, at least as robustly as we do today. And but they hadn't done anything like this with it. So we felt like we were partners with them, and we did work with them to be able to put up something similar. But most other states have struggled either with the politics, developing a consensus, or finding the resources to develop something like this. But one of the big advantages that we have with health cost is there's a greater public understanding of price variation. There's simply no explanation for why the price might be 2 or 3 times at one site versus another. And by simply putting it out there in the public space, you don't need to be a member, you don't need to pay anything. You can see how much variation there is. That led to benefit designs that actually reflect some of these pricing differences. You go to one kind of healthcare provider, perhaps you don't pay a deductible. Why? Because that healthcare provider is so much less expensive than the alternative, perhaps. There are other benefit designs that have evolved reflecting the fact that it's common knowledge, or at least it's available through health cost, how much the prices vary. And of course, some research that I'll mention in a minute that does show price concessions now that we've been posting these data in the public domain in New Hampshire. We did see lower prices. A review that was posted in the Economics and Statistics Journal was published in 2019. It was using pretty old data, though. So we have claims data in New Hampshire going back to 2005. The study used data between 2005 and 2011. And the research concluded that because of the health cost website, there had been a reduction in the cost of medical imaging procedures 5% for patients, 4% for insurers, and a total of about 45 million in savings. So I'd like to see an updated study, and I understand they're in the work in process phase, but clearly this has had a desirable impact, at least on the price of these services that we've been posting on health costs. Another set of research I'd like to reference is the Public Agenda Report. This came out in 2017. It was a national survey, and it was very insightful about how people were looking at price transparency across the country. They did focus a bit on the states that do have price transparency tools, including New Hampshire, but the survey was national in nature. And they did find that half of people have tried to find healthcare price information. Maybe not a surprise considering the level of cost sharing we have in our benefit designs today. When we started health costs, the typical deductible was maybe not much more than 500. And actually one of the criticisms was, gee, once you've hit your deductible, who cares what the price of information is? Well, that's certainly not true today. One of the interesting findings, I think, is that most Americans feel it's important for state governments to provide the healthcare price information. And I didn't mention that about half the people who did compare prices saved money. Then finally, 70% of Americans actually recognize that higher prices are not typically a sign of better quality care. And that's backed up hugely in the research. But it was interesting that the public also seemed to understand it. And almost 60% said they chose less expensive care. So this is what the website looks like, and I'm going to toggle over there if I can do it successfully. And I always tend to think of health costs, the real core function of it is to provide prices for consumers. That's where we started. That's where there's a lot of attention and interest. But some of the enhancements we've made to the website are actually the tools that draw more people to health cost than just the price. So somebody might be looking for information on what to do when you don't have insurance or how to navigate the system, and they'll end up at New Hampshire Health Cost because of the information we have available there. So hopefully I can toggle successfully to the actual health costs website. That's why am I not seeing? Oh, I got to go down a little bit. All right. So hopefully you can see health cost as well as we can. So the first thing I would say is you've got the 4 categories I mentioned. And I'm going to start with the fact first that we actually have a trademark on the website. We've also copyrighted the code that is used to produce the rates on health cost. When we started this project, we used public resources, and we wanted to make the technology, the approach, the algorithm, everything we're doing available to any other state that wanted to put information up like New Hampshire did. But we ended up having to trademark the website and copyright the code because somebody tried to copyright the code for us, in which case we would have had to ask their permission to use it. And that's not something we looked for. But we are still welcome to talk to other states. We're happy to provide our programming code, give everybody access to what we're doing and the advantages that come with health costs. So I'm going to go to that cost tab. First thing I would note is that we have prices for both medical procedures and dental procedures. I'm going to click medical procedures. The other thing we do with health cost is we produce rates for the uninsured. We use the same commercially insured patient claims data to produce those prices, and the uninsured will typically face the charges for those services unless the hospital or other provider gives them a discount. And indeed, New Hampshire hospitals give very good discounts to people who are uninsured. We actually use the information from the hospitals and produce rates for the uninsured using health cost information as well. But I'm going to go to Anthem because we're going to look at prices for a commercially insured patient today. The plan type is broken down between individual and group. The reason for that, for various reasons, is that the actual healthcare providers are paid different amounts depending on whether or not the member is covered by an individual policy or a group policy. And in general, the healthcare provider is paid more for the group, but most of us get our coverage through the group. So I'll click group. Now you get to choose the actual service you want to look at. There are two ways of doing that. One, you could look at all the procedures we have on the website, scroll through, find the one you're most interested in, or you could just start to type it and hopefully it'll come up. And then you see the output here, which will tell you the price of healthcare services at different healthcare providers. To take you through, there is a procedure code that's very specific information about what we're looking at, this particular chest x-ray. If you understand the CPT code system, you could use this code to learn more about how that service is actually described. The other thing I would note is that you've got information on what we selected. It's a medical procedure, it's an x-ray of the chest, the insurance carrier is Anthem, and then the plan type is the group. One of the things we did right from the beginning with health cost is we wanted to produce information that was most useful to consumers. So it doesn't help you to know when you go for a mammogram that the cost to a particular hospital or the amount paid for a particular to the hospital is only half the total amount you're going to end up paying. So even for something like a mammogram, there's a professional or technical component. So what we've done is we've bundled it together. We've taken the whole cost of the service, pulled it together, and what you see is essentially the price that a consumer would pay if their deductible applied to the whole thing and they were paying it out of pocket. So when you go down through, we've got the provider name and we've got a few columns. First thing I want to do though is you're probably not going to go anywhere in the state. Being that we're in Concord, in the Concord zip code, and I'll be willing to travel up to 20 miles. So now you've got a smaller list of healthcare providers. You can see that on the lowest end of the spectrum are Convenient MD, Clear Choice. You've got a statewide estimate for the total cost of $351. And you've got these little bubbles that'll tell you more about what you're actually looking at. These columns mean something a little bit different. So the estimate of the total cost is pretty straightforward. We do use the median to produce that. The average tends to be skewed by outliers, and the median is a better representation of what people are going to experience when they go to this particular provider. We also include precision of the cost estimate. This is a measure that looks at how much variation there has been in the data from one patient's visit to the next. If every patient has a completely different cost, then the precision of the cost estimate is going to be really low, and it's not going to be highly reliable if you were to go to that provider. But particularly for something like an x-ray, it's going to be pretty tight most of the time, so you're going to see a lot of mediums and highs. The last column is the typical patient complexity. So what we've done here is we've looked at the claims data for the particular patients that are showing up in the rates that went to that particular provider over a period of time that exceeds a year. And for those patients, if they've had a lot of cardiovascular care, perhaps a history of cancer, mental health conditions, each of those things will increase the potential patient complexity. And we've included this field to give you some insight about the types of patients one provider is seeing versus another. That may explain why the price is higher or lower at that particular provider for the service you're looking at. We don't adjust the rates. We don't make any assumptions about whether or not that's true. We simply provide it as information that could be helpful. But it perhaps explains why Concord Hospital's rate is on the higher end if they're seeing more expensive patients there. Perhaps there's something they're doing at Concord Hospital because of that patient population that lends itself to the higher prices for this particular service. We do reference the data source that we've used, as well as the time frame, and the fact the prices are increased by 5%. So let's assume you're most interested in comparing the hospitals in this output. Click the boxes for those hospitals, and you can compare the ones that you've got there. So we're still looking at that X-ray of the chest. We're still assuming you're covered by Anthem in the group policy. Now you can see the prices for those providers. You can also see the information on the cost estimate, precision of the cost estimate, and the patient complexity. But now you see information on the quality. So these are the quality indicators for the providers you've selected. And there are quite a few. The first category is open under patient-centered care. There is also more and more information as you scroll through. As I mentioned earlier, these data come from CMS. The other thing you can do is you can learn more about a particular provider that you've used in your comparison. So we'll open another tab, looking at Concord Hospital. It's got some basic information, including a link to the hospital, more information on quality, and you have the actual prices for all the services we have at Concord Hospital on health cost. Back to the home page. So as I mentioned, we don't use any proprietary tools, no black boxes. I also think people don't fully understand how much time we've spent looking at the services that we've posted on health cost. Talk a lot about the included costs and the review of the claims data. And these are actually real data for a particular procedure that we did not include. It's a diagnostic mammogram, which is different than a screening mammogram. Of course, these are codes and a reference that's now close to 15 years old, but it still illustrates the point I would make about data that doesn't support putting up a price on health cost. So if you knew you had about 221 services, the average is around 546, median mode are both 703, but look at the distribution of the prices in the data. You got all these up around 775, and you don't have so many in between. And down near closer to 300, you got a whole bunch there too. So what would you do if you're trying to come up with an estimate and tell somebody, well, your price is probably going to be around what? Would you use the mean at 546? Probably not. That's going to be too low for a whole bunch of people and too high for a bunch of other people. Chances are there's something separating the patients that we're looking at, some different treatment. But looking at the claims data, applying the algorithm the way we have, it wouldn't be helpful just to post an estimate of health costs and expect much reliability with it. So everything we've done is here. And as I said before, if there are better ways to do it, hopefully somebody will tell us. The other things that I mentioned is that statewide report that does allow you to see detailed information. And this is designed primarily for healthcare providers and insurers, but anybody can download the report. We do put it in the upper right-hand corner, hoping that most consumers won't go there or stumble across it without at least understanding what they're looking at. So I'm going to jump to that if I can do this easily. So this is what the statewide report looks like once you've put in your information, you've obtained the file. Again, comes from the same data source. It's the claims data, it's the CHIS. And what we've done here is we've taken all the insurers and we rolled them up into either group insurance or individual insurance and calculated rates at the procedure code level. This is the level of specificity that we have in the data about the services that's being performed. And as I mentioned, these aren't filtered. We didn't look to see whether the numbers are reasonable. We've provided information that, again, is hopeful to the groups we've produced it for. So there's a difference between whether or not the provider is a hospital or professional. That's the level of detail. We've broken it down. Same procedure code, and we include information that's based on the charges, as well as the price, which we refer to as the allowed amount. And then there's information on the actual quartile breakdowns. But within this particular worksheet, this is where I get to say we have thousands of services posted on health cost. Similarly, we do the same thing, but we break it down even further by carrier, same type of information. And you can see that what Anthem or Harvard or Cigna typically pays for the service and the range that's associated with it. We never go as far as saying Anthem pays Concord Hospital just up to this procedure code level with the level of detail we have here. But instead, we're trying to make the market function a little more efficiently. So I've jumped ahead a little bit. We're going to go into the employer section of the website. One of the things you can do when you've gone there is you can download the employee toolkit. And this is what it would look like. It's information in here about how to manage or select different benefit design information. So we go back to the home page, and the next sections I want to look at is the actual compare quality. And this goes back to the type of information that you can get when you're looking at the rates. This is a more direct access way of getting there. And you could look at whatever service you want to choose, or again, you could type in something like how long it would take for something. I don't like to wait too much, so you can see how the hospitals compare using those data. Performance, state average, number of minutes. And you can sort the results depending on what you're most interested in. And you can do this for each of the quality indicators that you might be interested in looking at. So one of the things we realized early on is that in addition to quality, in order to use price information most effectively, you've got to know how to navigate your benefits or navigate the healthcare system. So that's why we created the guide to health insurance, excuse me. And as you can see, it breaks down to getting health insurance or navigating the system. Each of these tabs leads you to additional information. So what we did is we set this up in an FAQ format, feeling like people didn't always know what questions they should ask or want to ask. It seemed to be a good way to provide people with the additional information. When you click that, you do get a request for a survey if you want to tell us more about your experience. But a basic question about whether or not health insurance covers preventive services and what's included, what it means, and then a little button if you want to tell us whether or not the answer was helpful or not. We always wonder whether or not people just don't like the answer and they might hit no, but you have to deal with what you've got. And apologize for having jumped ahead a little on the employer piece, but this is what the employer section of the website looks like. There's a small group comparison tool and an employee toolkit. And that allows you to put in your name, tell us you're not a robot, and then you'll get a document like the one I showed you a moment ago. For the most part, the employer resources section does include information we've obtained from other websites, but the insurance department does actually collect a fair amount of data from the insurance companies directly. And we actually produce an annual report, our annual cost and premium report that's done in tandem with our hearing. And that's where we get a lot of the data that populates this area as well. One of the common questions I'm answering with the legislature is a bit about the difference between self-insured or self-funded arrangements and fully insured or fully insured arrangements. So we have information for employers here. You want to know more? Click the actual link, breakdown, and we even have information on trends. Probably won't surprise most of you to see how benefits have changed, at least to the extent they may have become less rich. It's a relatively quick, high-level overview of what the website is. In addition to the methodology for health costs, we have it for quality. We also have contacts, and Maureen Mustard is listed as the contact today. We, interestingly enough, get a lot of questions that aren't related to health costs submitted through here. Some with some fairly specific health information, but we are here for consumers, so we do what we can to be helpful. So that's the presentation, the overview. We've got some time left, and I'm going to stop sharing the screen. I don't know if there are any hands that have been raised, any particular questions that we can be helpful with.
I see no hand.
All right. Well, everything we've gone through today is public information. The slides are available, as are the links on our website and the other files. If you're not downloading them directly from Health Costs, they're available through the insurance department's website or us directly. And yeah, so feel free to reach out to us whenever you would like. And that's one thing I didn't quite show was all right, I'm showing my incompetence between switching. I wanted to show you our contact info, which I do that right. And, there's me, and there's the more general contact information for the insurance department.
Tyler, I see your hand.
Senator Waters.
Yeah, thanks so much, everybody. What a terrific site you've created and so helpful. I'm sure I use it myself too. So I had a couple questions. I wondered how you're going to roll this out so people know that it's there. And then also, is this something that hospitals could be asked to provide to patients when they make a new contact, or practices as well?
Yeah, no, fantastic question. So we've always kind of kept the resources at the department somewhat limited. We didn't want this project to become too all-encompassing. That being said, we do have a more specific communication strategy. I can let DJ speak to the, but in terms of the providers and the carriers, some of them have decided to send their patients to Health Cost, and that's been helpful. But I think others have been hesitant to do so because they may show up more expensive, or for whatever reason are hesitant to rely on the insurance department to provide information about what's going on in their practice. And the good news is we apply the same methodology regardless of what provider it is. And this goes back to being a neutral entity. If you just went to one provider and said, what's the price of something? You never have any idea whether it's going to be comparable to the price you get from another healthcare provider, unless you're quite specific about how you ask for it. That being said, I think that the question occasionally does come up. Should we require the providers to do something, or should we even require the insurance department to produce flyers for those providers, do something more? And those are things that we have explored in the past. And
if I may just follow up on that very quickly, is that I do remember Senator Fuller Clark legislating and being particularly interested in people receiving healthcare comparisons costs, and I just can imagine how happy she will be to see this. But would it be something then that the legislature could potentially legislate on the requirement to provide this link by providers and practices?
So you probably could. I mean, remember that the insurance department regulates carriers. The providers are essentially regulated. That's not the right term, but they're overseen by their boards that license them. There are actually new requirements that have come from the federal level for both hospitals and insurers to improve their price transparency. In fact, over the years, we've had the website up, really the last 15. there has been a lot of interest in what New Hampshire has done in piggybacking on that. They've made resources available to other states. And in many cases, it's kind of interesting to see the new requirements coming forward and how much they mirror what we're doing here. But I think one of the things that's one of the differences between now and before New Hampshire was producing a health cost website is legislation that would come forward requiring providers to post their costs, their prices, their charges, something. We don't see legislation as much like that anymore because of we've taken the step forward and taken advantage really of the economies of scale of having insurance department do this for all providers rather than what are thousands of providers to produce information independently.
And to just follow up on that, Senator, as you know, I've just been on board a year now, and DJ's been on board less than that. But he and I share a passion for this data. We really view this tool as a crown jewel of the department. And so we're going to be working with our communications team to continue to increase the exposure of it, because I think it is a critical tool for consumers when making a healthcare decision. And that's one that, because of the changing kind of coverage landscape, it's more and more indispensable. And so I think we can do something to continue the push, the kind of PR push, to let people know it's available.
And just to that point, the big impetus for today's presentation is the fact that one of the first phone calls I had upon arriving here at the department was from a legislator who had filed a piece of legislation to essentially do what health cost does. And so the message that sent to me was, we need to redouble our efforts to make sure that our friends in the legislature are aware of this tool, because ultimately, not only is making you aware of it very, very useful, but obviously you, in communicating and interacting with your constituents, can make them aware of this great tool and opportunity. So this is going to be the first of a number of these presentations that we have planned to different stakeholder groups. As Tyler mentioned, this tool's been around for a little while, but we can't rest on the laurels of it. We've got to make sure that we keep pushing the message and making people aware that this is out there for them.
Any other questions?
Not seeing any. I'm going to thank you all for participating. We are going to package this video so that legislators that were interested but couldn't make this time slot have access to the information. I want to take a second and thank you, Tyler. Your passion for this work was evident today. I think you're looking at a very polished product, 15 years in the making, and thank you.
Thank you. Have a nice day, everyone.
Thanks, Tyler.
Tiffany, are you all set?